So what drives me to do community work is this reality of healthcare doesn't begin and end at the door of the clinic. So I like to tell all my colleagues in medical school, don't only do things in medical school, go volunteer outside in the community, go join community organizations, because that's when you really learn, how do I take care of someone? So my long-term career aspirations is I would like to match into family medicine psychiatry. But I feel like when you are working with communities that have historically been underserved, that you need to recognize that trying to separate someone's physical health from their mental health is not possible, and you actually end up doing someone a disservice, because the fact is every medical condition has a physical aspect and it has a behavioral health aspect. There has to be something inside the healthcare system that is driving these disparities that we see in health. And we know that as human beings, all of us have biases. I have biases, my family has biases, all my friends have biases. And some of these can be harmful, even if we don't realize what's happening. It can influence the type of thinking that we're having, and we may write off something in somebody that we would pay more attention to in somebody else. And so as physicians, we need to, and it would behoove us to turn that mirror and make sure not only are we looking at the care that we provide to make sure that it's meeting the standard, but we're also reflecting upon our own thought processes. And what I also want to do is not only work within the clinic, but I want to create a clinic where I can also go out in the community. I believe that it's just a sign of respect to the patient, showing that you are worthy of my time, even outside of the clinic, and you are worthy of healthcare even if you're not able to come into clinic and see a physician, because sometimes getting to the clinic is the hardest part of a visit. I don't want to just do another research study and say the problem exists. I want to start finding solutions, and I think the best way to do that is to start developing a service. Look at other folks who have developed these services as well and learn from the things that have worked for them and that haven't worked for them, but also recognizing that my community is a unique community and what works somewhere else might not work where I am.